The Physiotherapists Working with Physiotherapist Assistants Standard. It is every physiotherapist's professional responsibility to know and to follow the rules, regulations, and standards that apply to them and their profession. The Physiotherapists Working with Physiotherapist Assistants Standard came into effect on June 29, 2016. Take a moment to get familiar with the expectations of this standard. It's been broken down into 5 key areas: authority and responsibility, duties that cannot be assigned, assigning and supervising care, communication, and responsibilities of the alternate supervisor. Let's go through them in a bit more detail. Number 1. Authority and responsibility. A physiotherapist who assigns care to a physiotherapist assistant remains responsible for all of the patients that care. The physiotherapist must be listed on the college's roster. This expectation will not come into effect until the required technology is in place. Number 2. Duties that cannot be assigned. A physiotherapist must not assign the following activities to a physiotherapist assistant. This includes care the physiotherapist does not have the knowledge, skills, and judgment to perform, initial assessments and reassessments, treatment that would require the physiotherapist assistant, on their own, to change the established plan of treatment, any controlled act that has been delegated to the physiotherapist. Have a look at the Controlled Acts and Other Restricted Activities Standard. And any part of acupuncture, communicating a diagnosis, spinal manipulation, or internal assessment or internal rehabilitation of pelvic musculature. Number 3. Assigning and supervising care. The physiotherapist must carefully balance the risks of assigning and supervising care with the patient's best interests and quality of care. The supervising physiotherapist must ensure that the physiotherapist assistant has the knowledge, skill, and judgment to deliver the assigned care safely and with the same quality of care as the physiotherapist would provide. Discuss the roles and responsibilities of the physiotherapist and the physiotherapist assistant with each patient or their substitute decision maker. They should know the physiotherapist assistant by name and job title and give their consent to the care. Ensure the physiotherapist assistant's name and job title appear on invoices whenever they have provided all or part of the treatment. And provide a level of supervision suitable for the patient's condition, the clinical environment, the abilities of the physiotherapist assistant, and any other relevant factors. Number 4. Communication. The physiotherapist must have a written communication protocol that states how and when they will discuss patient care with the physiotherapist assistant, how to contact the physiotherapist, and how to contact the alternate supervisor if the physiotherapist cannot be reached. Number 5. Responsibilities of the alternate supervisor. The physiotherapist must designate another physiotherapist that the physiotherapist assistant can contact if they cannot be reached. If this happens, a transfer of care takes place. The alternate supervisor assumes responsibility for decisions about the patient's care and the care the physiotherapist assistant delivers. A physiotherapist who agrees to be the alternate contact for a physiotherapist assistant must be able to assume this responsibility, have the knowledge, skill, and judgment to perform the assigned care, be available to intervene according to the communication protocol. And that's the current Physiotherapists Working with Physiotherapist Assistants Standard. If you are ever unsure about the standard or have a question of any kind, reach out to the practice advisor. You can get in touch at practiceadvice@collegept.org or by calling 1-800-583-5885 extension 241. And be sure to have a look at the videos, frequently asked questions, definitions, and other resources that support this standard on the website, collegept.org.